There's a common condition affecting many women in the state, and what they may not know is that a physical therapist can actually help with treatment.
Beth Nicholson is joining us now to tell us more about how a physical therapist can help. Thank you so much for being here.
Yes, thank you for having me.
Thanks for being here, Beth. So we are talking today specifically about lipedema and lymphedema. So what can you tell us just about these conditions to start?
So lipedema is a fatty tissue disorder that affects primarily women. It's usually found either after people have babies or pre or postmenopausal. It's brought on by hormonal changes. And what it does is it essentially causes a buildup of fluid in the legs. And so they will have symptoms of heaviness, fullness. A lot of people describe their legs as being like stovepipes or tree trunks is what they feel like. And there's definitely therapy. It's fairly new to the medical world. And a lot of people don't know about it. It's often misdiagnosed, but physical therapy can be very, very effective with treatment of that.
So how can physical therapy help?
So what we do in the clinic is work on essentially retraining the lymphatic system how to function and work again to help drain the fluid from the legs and excrete it through the body so that it can move the fluid like it needs to, and it can alleviate the patient's symptoms and help them regain their lifestyle that they used to have.
Now, that was lipedema.
Yes.
How about lymphedema?
So lymphedema is very similar. The difference between the two is lipedema, as I said, is a fatty tissue disorder. Lymphedema is usually brought on, people will think of it like after someone has breast cancer and they've had lymph nodes removed. Because they don't have the lymph nodes to filter the fluid, they get the accumulation of fluid buildup. So they're very similar conditions, but they're brought on by different causes of injury, essentially. So we definitely can see both. We treat both the same, and they're very effective. Lipedema is usually affects both sides. Lymphedema is usually just affecting one side.
And how long does this treatment take? Is it weeks, years, months, forever?
It is weeks. It's a very intensive treatment. It's very comfortable. A lot of patients describe it as they're going to the spa.
Okay.
That's great.
But our goal is to kind of jumpstart the system and get them moving again. And then once we're done with treatment, a lot of it is doing stuff on your own through diet, exercise, compression garments, to make sure that you can carry on. Because once you have it, unfortunately, you always have it. It's just how you manage it long term.
And you know, we're talking about medical conditions. You might not always think of a physical therapist as being able to really help you. Do you have any stories you can share just about how, you know, how it feels good to you to be able to help people treat this condition and make some progress?
Yeah. So I think the big thing is when they come in, a lot of times they're debilitated. They can't exercise anymore. They report they can't go up and down the stairs. It's harder playing with their kids because their legs are just heavy, and sometimes they get depressed, so they don't want to exercise. And so as we go through treatment, a lot of times they'll be like, oh man, I am feeling so much better, like I have energy again. My legs don't feel as heavy, like I can go up and down the stairs and I don't get tired anymore. So it's really fun to see them from like the beginning stages to the end, because they really do begin to get their life back and can function again and do what they enjoy doing. And
is there a way for someone to see it coming, right? You don't want to wait too long, I would imagine. So what are like the onset symptoms?
Usually it's the heaviness, the fullness, burning, aching, and pain. Especially for women that have lipedema in the early stages, they might notice that their legs become really tender and bruise easy. I think that people really should probably be diagnosed even after they have babies. Not everybody is going to get it, of course, but I think that's when they start seeing those changes, and I think people will oftentimes think, oh, it's just because I've had kids, you know, I've gained weight, I haven't been able to lose it. And a lot of times it's really the early onset of lipedema, and sometimes people will go until their late 40s, early 50s. Again, like I said, they're that pre or postmenopausal age, and then they really realize that, oh man, like I've gained an excess amount of weight, I can't lose it. And that's when they start to notice the problem. So I think the earlier we can catch it, the better. And you know, it's not normal to have the bruising and the tenderness and all of that. So those are good things to look out for.
Good to talk with a specialist such as yourself as well. Thank you so much,
Yes.
Beth, for
Thanks,
being
Beth.
with
Thank
us.
you.
And CC's Physical Therapy has a location in Bismarck and a new second location in Hazen. To set up an appointment, you can call 701-751-0994.
And their website is ccsbismarck.com, and they are also on Facebook and Instagram.